As clinicians, we are always looking for the best assessment tool. Unfortunately, there is no practical way to assess the core. There are ways using fine wire EMG or using diagnostic real-time ultrasound imaging to see which muscles are actually active when you're doing certain movements. But really, those are not practical for the everyday clinician. So you have to come up with some sort of assessment tools that you can decide whether your client and patient has some so-called core deficits. So I've come up with a few different exercises, both for low demand patients as well as for more active and weight-bearing assessment tools. Remember, you can always rely on a patient's history. The patient's history gives you clues for what is a weak or non-functioning proximal control core, i.e., does the patient have respiratory problems, asthma, do they have a previous history of back pain? Look at their posture. If they show postural deviation showing an accentuation of the lordosis or reduction of lordosis, these are all clues that they may not be functioning properly in their lumbopelvic hip control. Let me show you 3 core assessment movements that we can use both as assessment as well as corrective exercise, and then we'll progress to weight bearing. The first one is a standing bridge. The standard bridge movement, I'm going to promote raising the arms up over the head. This obviously elongates the lat, which is a very, very important muscle in core stability. I do not want the hands down because then I'm going to result in retraction. Hands over the head, and you're going to ask your client to bridge. And if they show pelvic drop, or they show a lot of postural change, that's what you're documenting. If they fail with this, that's where you're going to start. You can also bridge and perform single leg. Again, you're looking at pelvic control. Can they stabilize through their left side? Then look at the other side. The next movement is going to be a quadruped movement, very, very common movement that we do with our patients and clients. And you're going to be looking at the same thing. The cue is going to be make sure that you draw in about 20% to activate your intrinsics, keep your airway open, and then you're going to perform alternate arm and leg movements. Notice how when I lengthen my right arm, I'm lengthening my left leg. I am not hyperextending my left leg. I'm not hyperextending and becoming glute dominant on my right side. It's a nice long extension. If I show pelvic drop, if I show postural change, that is what I'm going to do.